Can you tell me about your previous experience in phlebotomy?
Yes, I have been working as a phlebotomist for 2 years at XYZ Clinic. During my time there, I have successfully drawn blood from patients of all ages and with various medical conditions. I have also been responsible for maintaining a clean and sterile work environment and properly disposing of hazardous materials.
How do you handle patients who are anxious or nervous about getting their blood drawn?
I understand that many patients may feel anxious or nervous about getting their blood drawn. To help alleviate their anxiety, I always introduce myself and explain the procedure in detail. I also try to create a calming environment by speaking in a gentle and reassuring tone. If necessary, I may also offer distractions such as music or conversation to help them relax.
What do you know about infection control and safety procedures in phlebotomy?
Infection control and safety procedures are extremely important in phlebotomy. I am well versed in all of the necessary protocols, such as hand washing, wearing gloves, using sterile equipment, and properly disposing of contaminated materials. I also understand the importance of maintaining a clean work environment and following proper procedures for disinfection and sterilization.
Can you describe a challenging experience you had while working as a phlebotomist and how you handled it?
One challenging experience I had was with a patient who was extremely nervous and kept moving his arm during the blood draw, causing the needle to come out and the blood to clot. To handle the situation, I took a step back and explained to the patient that it was important for him to remain still during the procedure. I also used a gentle touch and spoke in a reassuring tone to help him relax. Eventually, I was able to successfully draw his blood and the patient left feeling more comfortable and less anxious.
Why did you choose to pursue a career in phlebotomy?
I have always been interested in healthcare and helping others. I chose to pursue a career in phlebotomy because I believe it is an important part of patient care and can make a significant difference in their diagnosis and treatment. I also enjoy the technical aspects of the job, such as mastering the different techniques for drawing blood and ensuring that the samples are properly handled and labeled.
How do you ensure that you are properly identifying patients and their specimens?
Patient identification is crucial in phlebotomy to ensure accuracy and avoid any errors. Before starting the procedure, I always verify the patient's name and other identifying information, such as their date of birth or medical record number. I also make sure that the specimen labels match the patient's information and that they are properly labeled with the date and time of collection.
How do you handle difficult veins or patients with small veins?
Difficult veins and small veins are a common challenge in phlebotomy. To handle these situations, I use various techniques such as applying warm compresses, using a smaller needle or butterfly needle, and adjusting the angle of insertion. I also communicate with the patient throughout the process to ensure their comfort and let them know what I am doing.
Can you explain your understanding of HIPAA regulations and patient confidentiality?
HIPAA regulations are in place to protect patients' personal health information and ensure their privacy. As a phlebotomist, I understand the importance of maintaining patient confidentiality and the consequences of any breaches. I follow all necessary protocols, such as securing patient records and only sharing information with authorized individuals. I also understand that patient information should not be discussed in public areas and always maintain discretion when working with patient information.
How do you prioritize your tasks and manage your time effectively?
Prioritizing tasks and managing time effectively is crucial in phlebotomy. To do this, I usually start by assessing the workload and the urgency of each task. I also try to anticipate any potential issues that may arise during the day and plan accordingly. During the day, I regularly reassess my priorities and adjust my schedule as needed to ensure that I am meeting all deadlines and providing quality care to my patients.
What do you think are the most important qualities for a phlebotomist to possess?
In my opinion, some of the most important qualities for a phlebotomist to possess include attention to detail, strong communication skills, the ability to remain calm under pressure, and a commitment to patient care. Phlebotomy requires precision and accuracy, as well as the ability to put patients at ease. It is also important to be adaptable and able to handle unexpected situations with grace and professionalism.
Can you tell me about a time when you had to handle a difficult or upset patient?
Yes, I had a patient who was extremely upset about getting their blood drawn due to a fear of needles. I started by speaking with the patient and explaining the procedure in detail, as well as answering any questions or concerns they had. I also used distraction techniques, such as talking to them about their interests or playing calming music. Additionally, I used a smaller needle and butterfly technique to make the experience less painful for them. By the end of the procedure, the patient was more calm and left with a positive experience.
What do you see as the biggest challenges facing phlebotomy in the healthcare industry today?
One of the biggest challenges facing phlebotomy in the healthcare industry today is the increasing demand for blood draws and testing, which can put a strain on resources and staffing. Additionally, there is a need to continually stay up to date with new technologies and techniques in order to provide the best care possible to patients. It is also important to maintain a focus on safety and infection control, especially given the ongoing COVID-19 pandemic.